Hello, volunteers. Thank you for joining me for today's HIPAA Awareness Training for Volunteers, Health Insurance Portability and Accountability Act, Protect Patient Information, from Meadowlark Hospice. Today's HIPAA Awareness Training objectives are to understand what HIPAA is, understand patient rights, know the consequences of noncompliance, and know how to report noncompliance. Our overall goal today is recognizing the importance of making a commitment to patient confidentiality. First of all, let's talk about acronyms. What do all those letters mean? HIPAA, not a hippo. HIPAA means Health Insurance Portability and Accountability Act. TPO means treatment, payment, operations. PHI, personal health information. And NPP is notice of privacy practices. If you've had any dealings with medicine, you've probably heard some of these acronyms. What is HIPAA? It was enacted in 1996 and is a federal law that sets out rules for sharing personal medical information and protecting it from unauthorized uses. HIPAA is based on two important ideas in patient care. The first of those is privacy, a person's right to limit who knows what about your medical condition. It also refers to the right to have conversations about medical care in places where others cannot overhear. The second important idea in patient care that HIPAA is based on is confidentiality. It refers to a person's right to limit or place restrictions on who can access and share their medical information. Doctors can share medical information with nurses, therapists, and other healthcare professionals on the patient's medical team. This is important for good care and is not affected by HIPAA. As a volunteer, you might wonder, am I involved in HIPAA? It is everyone's responsibility to take the confidentiality of patient information seriously. Anytime volunteers come into contact with patient information or any personal health information, written, spoken, or electronically transmitted, they become involved with some facet of HIPAA regulations. It is for this reason that the law requires awareness training for all personnel, including volunteers. Removing a patient name from a chart is no longer sufficient to de-identify the patient. HIPAA refers to this information as PHI. PHI includes much more than your name. PHI, or Protected Health Information, includes addresses, dates, telephone or fax numbers, social security numbers, medical record numbers, patient account numbers, insurance plan numbers, vehicle information, license numbers, medical equipment numbers, photographs, fingerprints, email addresses, and even internet addresses. One of the questions that I hear from volunteers are, how can I comfort my patient, or how can I write my patient without knowing anything about them? We do at Meadowlark Hospice give you some information about your patient, because sharing patient information falls under the consent rule. HIPAA, under the consent rule, allows for the provider, in this case Meadowlark Hospice, to use health information for treatment, payment, and operations. Before HIPAA, it was common to use patient information for other purposes and to share more than the minimum necessary information. Under the minimum necessary rule, volunteers have access to information they need to fulfill their assignments. Speaking of sharing information, what is TPO? TPO is treatment, payment, operations. HIPAA allows us to share patient and client information for very specific purposes. The first is treatment, or providing care to patients or clients. The second is payment, getting paid for caring for patients and clients. And the third is operations, normal business activities such as quality improvement, training, auditing, customer service, and resolution of grievances. Like every rule, there are consequences. Under HIPAA, there are now fines and penalties for sharing information about a patient. Meadowlark Hospice treats privacy very seriously, which is why every volunteer is required to sign a confidentiality form. A breach of privacy hurts everyone. Wrongful and willful disclosure of health information carries fines and can involve jail time. When in doubt, don't pass along information you may see or hear about hospice patients, friends, or acquaintances. New patient rights under HIPAA include that patients can obtain a list of whom their health provider has shared their health information for the past 6 years. All they have to do is go request that from their health provider. They can request to amend their medical record, and they can request other communications, such as asking to be notified of lab results only at work and not at home. Review and copy their medical record, and request restrictions on the use or sharing of their information, such as opting out of the hospital directory or saying no publication. Stop and remember. Stop and ask yourself, should I be sharing this patient information? If it doesn't pertain to TPO, treatment, payment, operations, don't discuss it. Think of patient information about fellow volunteers, neighbors, and acquaintances as protected information, not for sharing. Dispose of patient information by placing it in a shredder or return it to the volunteer coordinator. Turn computer screens off if you leave your computer for any reason. Report all abuses. Enforcing the regulation is everyone's responsibility. The HIPAA Anonymous Hotline is 1-800-368-1019. That HIPAA Anonymous Hotline is staffed 24 hours a day, 7 days a week. The Chief Privacy Officer for Meadowlark Hospice and Clay County Medical Center's phone number is 785-632-2144. Thank you for attending today's Meadowlark Hospice training, HIPAA Awareness for Volunteers. Are you HIPAA wise? Take our online or paper quiz to find out. Thank you.